Insurance companies across the country are struggling to offset the rising costs of U.S. health care. Some insurers have reported significant losses since the Affordable Care Act went into effect in 2010, and they will seek to offset that dip in profits by raising premiums. For example, 9 companies in Virginia are looking to increase rates by an average range of 9% to 37%. The health law was supposed to lower costs for patients and insurers, but that's yet to happen in the country that spends the most on health care. The U.S. spends almost $9,000 per capita on health care, more than twice the average of other developed countries. For contrast, France spends just over $4,000 per capita, but has the best health care system in the world, according to the World Health Organization. The U.S. ranks 37th, one notch below Costa Rica. With that in mind, there's no surprise that a new study found medical mistakes are the third leading cause of death in the U.S. The authors suggest doctor error now ranks behind heart disease and cancer, accounting for hundreds of thousands of deaths annually. RT's Manuel Rapalo has the details.
Smoking can kill you, a heart attack can kill you. I mean, there's a million ways a person can die. But you probably wouldn't expect a visit to your doctor to make that list. At the very least, not rank number 3 on the leading causes of death in the United States. And yet, that is exactly what the authors of a new study have published. Check this out. According to data from the CDC, cancer and heart disease still rank as the 2 leading causes of death in the U.S. But where respiratory illness once ranked as number 3, medical error has taken that spot and actually accounts for an astonishing 251,454 deaths every year. Medical error is outpacing Alzheimer's, diabetes, and suicides. Okay, so when we're talking about medical error, you might have an image like this one that comes to mind. Now, there's no doubt that this is a pretty gruesome thought. And by the way, this x-ray is totally real. These are a pair of 7-inch scissors left inside the abdomen of a 69-year-old woman. The mistake caused her 18 months of pain and discomfort until those scissors were removed. And true enough, situations just like these are not that uncommon. A Consumer Report found that between 2005 and 2012, almost 800 medical tools were left inside of patients, putting them at risk of serious harm. The latest report on medical errors, however, doesn't focus on accidents like these as a cause for concern. The study actually points to cracks and flaws in hospital systems that lead to people being hurt and even dying. Dr. Martin McCary of Johns Hopkins University is one of the authors of that study. He explains.
We're increasingly recognizing that communication breakdowns can directly cause a patient's harm and even death. We're recognizing that diagnostic errors, as we call it, or giving you the wrong label, or missing a distress signal, what we call failure to rescue, or the lack of a safety net. We don't want to blame individuals. We want to look at the system. And hospital systems oftentimes have these cracks and failures to provide the protocols, safety nets, and other triggers in the system so we can respond quickly to patients in distress.
Dr. McCary adds that it is a good idea to ask your doctor lots of questions and even have someone else with you during a consultation. And it's never a bad idea to get a second opinion. Manuel Rapalo, RT Studios, Washington.